Hello, my name is Blaine Welk, and I'm happy to present this abstract on the differences in the incidence of urinary tract infections between neurogenic lower urinary tract dysfunction patients and non-neurogenic lower urinary tract dysfunction patients who perform intermittent catheterization and analysis of MarketScan data. This research was supported and funded by Coloplast. So let's start with looking at health insurance claims and how we use that to characterize urinary tract infections, neurogenic dysfunction, and intermittent catheter users. We use the MarketScan database, which is a preferred provider organization that captures millions of patients in the United States who have a private insurance plan. It also includes the Medicare supplemental information. We used a 4-year time period from January 2015 to December 2019. And what we tried to do first was identify all the intermittent catheter users. So we found a total of 43,000 intermittent catheter users, and then we excluded those that were less than 18 years of age, those who did not have continuous health insurance coverage, they were pregnant, and then we also excluded those who were already using IC prior to the start of the study date. So we had a look back period to determine that. We then used ICD codes to determine who had a likely neurologic disease, in most cases people with spinal cord injury or multiple sclerosis, and then patients who did not have evidence of a neurologic lower urinary tract relevant disease. As you can see, we identified in the end 6,000 patients who use IC or who were new IC users during that time period and had neurogenic disease, versus 5,000 who were new IC users and did not have neurologic disease. We used a 6-month baseline period to determine new use, and we followed each of these patients for 1 year to determine their risk of urinary tract infections. Looking at our results, so we found that patients using intermittent catheter experienced a high incidence of urinary tract infection. So if we look at the first graph here, you can see IC users with neurologic disease had the highest proportion that experienced at least 1 urinary tract infection over a year. Non-neurogenic bladder IC users had a slightly lower risk, which was statistically significant. And then finally, the general population did not have very high risk of urinary tract infections compared to the other two groups. When we look here with the patients with 3 or more urinary tract infections over the course of that year, you can see again, neurogenic lower urinary tract users had significantly more episodes of multiple urinary tract infections compared to the general population. And again, this number is much higher than the non-neurogenic IC user. So we also found that neurogenic patients using IC experienced more hospitalization. So the greatest percentage of inpatient hospitalization was associated with the urinary tract diagnosis, and a longer average hospitalization was found among neurogenic patients as opposed to non-neurogenic patients. If we look through our 3 graphs here, we can see the proportion of patients with greater than 1 urinary tract infection who were hospitalized. It was about 11% for neurogenic patients, 4% for non-neurogenic patients, and less than 1% for the general population. When we look at the proportion that were hospitalized with a urinary tract infection, among those who had urinary tract infections, this is taking the subset that had at least 1 urinary tract infection to begin with. Again, neurogenic patients make up the greatest proportion. Length of stay was different between the non-neurogenic and the neurogenic patients, although the difference was relatively small. So finally, we wanted to look at the risk of hospitalization associated with urinary tract infection in the non-neurogenic compared to the general population compared to the neurogenic. And really these hazard ratios are quite profound. When you look here, you can see versus the general population, neurogenic patients using IC had almost an 18-fold increased risk of hospitalization for a urinary tract infection. Non-neurogenic IC users had a 6-fold increased risk. And this was obviously statistically significant. The key takeaways from this study: IC users have a significantly higher incidence of urinary tract infections than the general population. Compared to non-neurogenic patients who used IC, neurogenic patients had higher incidence of urinary tract infections, higher hospitalization rate, and almost twice the rate of 3 or more urinary tract infections. This study shows that neurogenic patients who use IC are much more at risk of urinary tract infections than both the non-neurogenic IC users and the general population. Thank you very much.